Good morning, all of you.
Good morning.
So, doing yoga, doing exercise, whatever we are learning here. Yeah? Enjoying? So, we will start today also. Today class will be inspiring to make it right way, right exercise, and around the breathing. Breathing is very important part. I explained earlier also. Breathing is the main to improve any exercise benefits, and secondly involving your entire internal organ. That is the very important, right? So we will go with that, right? So we will start sitting comfortable pose, comfortable, whatever your comfort, that's fine. My comfort is this, I am in this position. Put your hands here, gently close your eyes, connecting with your breath. Make it breathe till your navel. You can put your hands over the chest and your diaphragm to feel the breath. Inhale. Exhale mouth. Inhale. No, more. Exhale. Lengthening the breath. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Gently open your eyes. Support your hand. Inhale. Push your hands back. Bring your scapula closer. Arch your spine, look towards ceiling. Exhale, activating all the entire body. Now 2, inhale. Yes, nicely you can feel the stretch. Exhale mouth. 3, inhale. Interlock your finger behind your back. Lift your hand, chest up. Interlock your fingers up. 1, 2, 3, interlock your finger back. 4, 6, 5, exhale. After raise your hand like someone pulling your hands. Lift your hand like someone pulling your hands towards this. Is it not possible? Come here. Put it like this way. Engage your core muscles. Hold. 5, 4, 3, 2, 1. Left side, left hand, left side. Yes. Now, slightly bend your elbow, go deeper without lifting the sit bone. Come on, hold here. 5, 4, 3, 2, and 1. Again, interlock your finger like someone putting your hands toward the ceiling. Engage your core muscles. Hold here for 5, 4, 3, 2, 1. Exhale, right side. Go as much as you can. You can feel nice stretch over the side belly. This is also helps to remove all the toxins from your bowel. 4, 3, 2, and 1. After twisting, exhale mouth. Left palm behind your right sit bone, right palm over the left knee. Twist yourself. Inhale, center here. Inhale, this is inhale. Exhale here. So when you're going, you have to suck your abdominal. When you suck your abdominal, you can twist nicely. Inhale, center. Exhale. exhale mouth. Last round, inhale, exhale left here, look back, hold for 5. Feel the twisting over your spine, over your abdominal muscles. 4, 3, 2, 1. Inhale, exhale mouth. Hold for 5, 4, 3, 2, and 1. Release. So these exercises which helps to detoxify your body. You can feel that this part, you can feel this one. So toxins means whatever we eat, whatever we are taking air, like all the toxins we are adopting every day. So these few exercises, only 3-4 exercises we did, that will help to remove the toxins from our body. If you are not doing that, if your body consuming more and body is not passing the toxins, that going to accumulate in the fat. Why? That is why people getting growing weight and all that, getting so much problem. So these 3-4 exercises you can keep mind, you can do by yourself. Yeah. Next practice. Come here. Neck eye pose. Knee open to the mat level. Palm. Inhale. Squeeze your this part, your especially lumbar region. Looks towards ceiling. Squeeze. Hold. 5, 4, 3, 2, and 1. After stand over the knee. Side. Open your hand. Left side. Your left palm, just the line of the knee over the mat. Put it. Side, sir, side. Little bit more. Take a gap like me. Great. After, push your hip forward. Push your hip, this portion forward. After, hands connecting to ear. Hold here for 5, 4, 3, 2, 1. Inhale, center here. Other side, same way. First take the position. After, push your hip forward and connect your hand to the ear. You can feel nice stretch over your waist, over your side belly. Hold 5, 4, 3, 2, 1. Deep breathing here. After, put your hands here, like this way. Inhale. Look back. Hold here. Push your waist forward. Push your pelvic forward. Hold here. Hold for 5. Keep breathing. Come on. 4, 3, 2, and 1. After, grab your wrist. Hip down. Lift your hand. Remember, you should not lift your hip now. Just down your upper body with exhale. Suck your abdomen. Your abdomen should be pressing over the thighs. Hold here. Hold. Go as much as your body allow you with hip down, back side. 5, 4, 3, 2, and 1. Come to center here. Again, stand over the knee. These are exercises impacting over the back, over this area, over waist. So which means your back also gets released, abdominal also get proper and also your this area. Okay. So multi-purpose, we can say the multi-beneficial workout exercise we are doing, right? Now open your hand. Also you can realize when you are doing anything, you will feel where is the getting stretch and all that. Left side. Your left hand. Try left hand over the right hip. Hold here. 5, Do as much your body allow you. No need to push more. 4. Very good. 3, 2, and 1. Inhale center here. Be careful. Very good, sir. You're doing good. Right side. First turn. Push your hip forward. Try to put your right palm over the left heel. Hold. 5, 4, 3, 2, and 1. After again, raise your hand. Push your pelvic forward. Hold here. Hold. 5, 4, 3, 2, and 1. Exhale. This is rapid pose. This is relaxing pose. Your abdomen should be pressing over the thighs. Remember that. Compression helps also in your digestive system, in your internal organs. Hold here for 5, 4, 3, 2, and 1. Inhale. Open the shoulder. Exhale. After bend your leg, open your knee to the mat distance. If you can lock your ankle, that's fine. Who don't want, who not able, put it that way. And who can do that, lift. Hold here, look towards ceiling. 5, 4, 3, 2, and 1. Exhale, rabbit. This is relaxing. You can feel that your back is relaxing, your chest region, your hands, your legs. Keep breathing here. Inhale, exhale, inhale, exhale. After sitting in this position, again we are going for Mandukasana. Mandukasana, why we are doing? So mainly increase the pancreas and all that. Okay, that's helps in digestive system. Put your hands here, this way. Come. Exhale with suck your abdominal as much as you can. Hold there. After press, your navel should be in the center. After hold, and hold your breath also outside. Hold your breath also outside. Hold for 10. Hold your breath outside. Hold the posture. 2, 3, 4, 5, 6, 7, 8, 9, and 10. Inhale. Come up. Exhale completely like a blowing with suck your abdomen towards your spine. Suck your abdomen as much as you can. Hold there. After press and go down. Hold. Hold your breath also outside. It's a very important. It's a very beneficial. It's also boost your internal system. 9, 8, 7, 6, 5, 4, 3, 2, and 1. Inhale up. Exhale, third round. Completely and hold as much as you can. Now, hold, go down, hold, exhale. 1, 2, hold your breath outside. 3, hold your posture. 4, 5, 6, 7, 8, 9, and 10. Release. Deep breath. Deep breath. Both palms, left side. Both palms together. Bend your hand. Head down. Hold 5, 4, 3, 2, 1. In the center. Right side. Exhale. Exhale. Hold 5, 4, 3, 2, and 1. Release. Relax. Keep breathing. Again, relax yourself. Make it breathe as much as you can. You can sit comfortably. Inhale longer, exhale longer. Inhale longer, exhale longer. Relax, release. So now it will go one lecture. You can go with that. After that, you can come again back. You can feel that few minutes. Your body is sweating. Your body is feeling the activity. That is very important. Yeah. So I will back again.
Director and Head of Chemotherapy Department at Chennai Urology and Robotics Institute Private Limited, Chennai. She pursued medicine from Mankala University, Maharashtra. She chose to work in oncology. We all know how difficult the department is. Her practice in this taught her to handle psychological aspects in counseling. She believes in applying passion to one's profession, and last but not the least, she is the person who loves yoga. So let's all welcome her. She is here to talk about 21st century diseases. So we're going to have a lot of value additions and knowledge. So kindly pay attention. Thank you.
21st century disease. What is modern day disease? Anyone can tell what disease? Yes.
Addiction to internet.
Yeah. Very modern that is. Today, dreadful C word I am going to talk about. Cancer. Actually, cancer you should treat like any other disease. All the disease can happen to anybody. Lifestyle changes reduces the intensity of disease, and early detection cures, whether it is typhoid or cancer. And there is always a chance of recurrence even for heart attack. So why are we taken aback the moment we say cancer? Because there is a lot of myths and myths attached to it. If I start speaking about cancer, it will take 10 days. I just want to emphasize on all of you to learn what cancer is and what is the magnitude. See, there is a difference between knowing the magnitude and getting scared about it rather than getting cautious about it. These two aspects I think all of us know. Yeah, definitely people have improved due to improved communication. They are more aware about things. But that fear factor hasn't gone. It's a high time that we should overcome that. Next slide please. So, what used to happen in those days, people used to die of infection. We don't hear all those things now. Plague, typhoid, cholera, those pandemics, pandemic, COVID at least medicines hospitals plague, cholera last epidemic swine flu was recent, SARS, okay, it didn't affect us but it did affect some countries. So those kind of infectious diseases have come down, and that inevitably improved the standard of living, and economic situation in India and other countries also have improved, so their nutritional status is better, so people started surviving longer years. Maternal mortality in Bangladesh. Half the people will die, women will die. The maternal mortality rate used to be 50% in 1936, and today it has come down to 15%. Okay, still long way to go. One, the number of children they started producing is less, and another thing, hospital and medical availability. So people started living longer. You will be surprised, women lives 3 years more than men. That's the statistic today. So as you live longer, the old age diseases starts coming up. ஒரு ஊர்ல அந்த காலத்துல 1000 பேர் இருப்பாங்க. அந்த 1000 பேர்ல வந்து ஒரு 5 பேர் தான் 80 வயசு தாண்டி இருப்பாங்க. 5 பேர்ல எத்தனை பேர் கேன்சர் வரப்போகுது? ஸோ அந்த காலத்துல கேன்சர்ல இந்த காலத்துல கேன்சர் இருப்பாங்க. இப்போ வந்து ஒரு ஊர்ல அதே ஸ்ட்ரீட்ல போனேன்னா அந்த அடையாளம் இல்லையானா கிட்டத்தட்ட 10,000 பேர் இருக்காங்க. வெர்டிக்கல் டெவலப்மெண்ட் ஹஸ் ஹேப்பன். அந்த 10,000 பேர்ல 80 வருஷம் தாண்டினா மேக்சிமம் குழந்தைங்களாம் வழியில் போயாச்சு. கிட்டத்தட்ட வந்து 800 பேர் 80% 80 வயசு தாண்டினவங்க. Obviously it looks magnified, but definitely cancer was there and it is there now also. Only thing it looks bigger because we are seeing from different angles. The old age population in India is more than 40%, so obviously we are going to see it more. Next one. The reduction in infection rate, death has increased average survival rate for men and women. This is whatever I told you. Today even developing countries are at par with India. நிச்சயத்தில் காம்படிஷன் பண்ணணும் எஜுகேஷனில் தான் survival rate we are definitely at par with anybody. And lot of information and dispersal has caused us to receptive, more receptive. இதே வந்து 30 வருஷத்துக்கு முன்னாடி கோவிட் பற்றி யாராவது சொல்லியிருந்தா அம்மா போட்டு இருக்கு இல்லை ஒரு அம்மன் அப்படின்னு சொல்லிட்டு ஸ்டார்ட் பண்ணியிருக்கோம். But today we know, and actually it is like that. Smallpox was also an adenovirus and COVID is also adenovirus. Smallpox used to affect the dermoid thing like your skin. இது வந்து it affects exclusively your lung. It is the same. விட்டுருந்தா அப்போ அந்த காலத்தில் அப்போ நம்ம ஒரு கோவில் கட்டிட்டு அதுக்கு ஏதாவது ஒரு பேர் வச்சு நம்ம பண்ணிருக்கோம். But that communication and education has improved and quick response by our community. I think we saved almost 50% of people from succumbing to COVID. And increased survival age has led to aged population and relatively increase in the age-related disease. Next slide, ma'am. What are all non-infectious diseases? As we have told, diabetes and hypertension tops, and that leads to renal disease. It's one. இங்கே வந்த அப்புறம்னா இன்னும் magnitude ஜாஸ்தி இருக்கு because in the hospital renal medicine and urology related பண்ணதுனால is blaring. Who can affect with renal disease? Anybody from 3 years to 90 years. Ischemic heart disease. இது எல்லாத்தோடையும் விளைவு is ischemic heart disease. But இது எல்லாத்துக்குமே சம்மந்தம் இல்லாதது கேன்சர். அடுத்தது. So there are two cancers I want to. It's the magnitude I have shown not to scare. What I am trying to tell is so common. So CA breast in India 15.8 per lakh women. And it has gradually increased and that has attributed to 98,000 deaths in a year. So 100 cancer patients, 45 patients died because of CA breast. Then CA cervix, garbhapai cancer, 23.7 out of 1 lakh women. If it is detected early stage, இது ரெண்டு கேன்சரும் நீங்க early stage detect பண்ணாக்க curable, 98% curable rate. You know what is the curable rate of ischemic heart disease, heart attack and that? That's only 93%. We are still better. Okay, carcinoma of ovary, that is 5 to 8% per 10,000, 1 lakh people. But you know the mortality rate in ovarian cancer is high. And carcinoma of colon, which is relatively less, we still use the traditional food, curry and the maripani sarthana, kamya 3.5. But the same Western people who use more refined maida, எங்கே பார்த்தாலும் அவங்களுக்கு வந்து ஒரு ஈஸ்ட் இருக்கும், ஒரு மைதா இருக்கும், ஒரு பட்டர் இருக்கும். அதை வச்சு இந்த கலராக ஷேப்பாக மாற்றினா அந்த சாப்பாடு உணவு எடுத்து அதனால வந்தது வந்து they have 15 in 10,000, 1 lakh population. So it's actually 5 times more than us. Next slide. What is cancer? Everybody says cancer, cancer, cancer. என்னதான் கேன்சர் எங்கன்னா வந்தது? You know, human being has developed from 2 cells, sperm and ovary. So those 2 cells divide and a baby is formed, and as we grow also cell division attributes it. But how a particular person's shape, size, features are maintained? So normal cell divides in particular manner to retain the functional ability of the region. So liver la irukra cell வந்து திடீர்னு bladder மாதிரி வேலை செய்யாது. liver la irukra cell liver function தான் divide பண்ணும். Skin வந்து skin தேவையான அளவுக்கு தான் divide பண்ணும். And the duration and number of time division is controlled. It is programmed by God. அதனால தான் மூக்கு வந்ததே போலே அது ஒரு ஷேப் மெயின்டைன் பண்றதுல so number of time it can divide with the retaining of function is programmed. And after say skin multiplies for 16 times, ஒரு செல் எடுத்தேன்னா 16 வாட்டி is multiplied அதுக்கப்புறம் அது will dead. That is called apoptosis. So it ceases the function. அடுத்த ஜெனரேஷனுக்கு முன்னாடி இருக்கும். बड़े skin cells से generate the older cells will produce more abnormal cells. So beyond certain limit, it will die on its own. That's called apoptosis. This is normal. But what happens in cancer? That two cells when divides and produce a daughter cell, there is 50% chance that that cell is abnormal, 50% chances that cell is normal. ரெண்டு ஒரு குழந்தைய வளர்க்குறோன்னா 50% வந்து அவங்க நார்மலாக நல்லவனா வரக்கு வாய்ப்பு இருக்கு, 50% கெட்டவனா வரக்கு வாய்ப்பு இருக்கு. Those abnormal cells which is happening even now while I am talking, every organ undergoes multiplication except brain and heart cell, which has to survive what God has given at the time of birth. So, on the abnormal cell, your body will recognize as a foreign cell and it destroys. This is the mechanism. That's how we maintain normal upper shape. Those cells will start taking the place of normal cells, but more or less retaining the functional ability. There is no limitation number for amount of time they multiply. So, normal cell 10 வாட்டி 16 வாட்டி multiply பண்ணா அது 1000 வாட்டி multiply ஆகும். They will multiply faster because they are thriving on the nutrition of the local thing. And top of that, they won't die. There is no apoptosis. So they will go on and this is exactly what happened. That will take over. Now you tell me where it is influenced by any other factor. Right now I am talking to you, except my brain and heart cell, every cell is undergoing multiplication. Every cell produces the abnormal cell somewhere. In the production அதை எலிமினேட் பண்ணுறதுக்கும் ஆண்டவர் சிஸ்டம், அந்த சிஸ்டம் மாறினாதான் கேன்சர் வரும். தலையில் இருக்கு இதெல்லாம் சுத்தம் வேஸ்ட். திஸ் இஸ் த ரேஷனல் சிம்பிள் ரீசன் பிஹைண்ட் ஹேவிங் கேன்சர். அடுத்தது, ஸோ திஸ் இஸ் அவர் செல். திஸ் ரெப்ரசன்டட் one particular person. This is me. This is what I am. These are the cell components. So this multiplies. The one cell divides and forms the two daughter cells. Now this can be abnormal. So this will get eliminated. But if this doesn't get eliminated, it hasn't been programmed or systematically school every 5 மணிக்கு வரணும், 4 மணிக்கு வரணும், 5 மணிக்கு போகணும், அந்த மாதிரி இல்லை. What போடலாம், what addition, it will take away the nutrition of surrounding normal cells. So normal cells cease to grow and they occupy the new place. Next one. So there are two diseases I want you to pick. The mechanism same for any tumor, whether it is brain, skin, anywhere, except your hair and nail, which is dead cell. Anywhere you can get cancer. From 2 days old child to 90-year-old man, anybody can have cancer. So nobody should tell that I am immune, I crossed that way. It's not possible. Most common and number one disease, cancer in woman is CA breast. I think since the child becomes 14-15-year-old, start teaching them. சரியா உட்காரு, அப்படி பண்ணாது இப்படி பண்ணாதுன்னு நம்ம சின்ன வயசுலேருந்து சொல்லி கொடுக்குறோம். போலே 16 வயசு receptive age. Each nowadays kids are much more smarter. Start telling them what. நம்ம சொல்லி கொடுக்காட்டி யார் சொல்லி கொடுக்க போறாங்க? இது ஒரு டீச்சரோ இதுக்கு ஒரு டாக்டரோ தேவையில்லை. What is the magnitude? 1 in 8 in India. If 8 ladies are sitting, one of us likely to have cancer in our lifetime. That is the magnitude. இன்னைக்கு இல்லை, நம்ம 8 பேர் இருக்கோம், இன்னைக்கு இல்லை, அதனால வரவே வராதுன்னு. One of us are prone for cancer. And in Western countries, 1 in 4. நான் பொண்ணுங்க ஒரு ரூம்ல இருந்தாக்க ஒருத்தர் கேன்சர் இருந்திருக்கணும் இல்லை வரப்போகுது. Why the Western countries have more proportion than India? First childbirth age. Their average first childbirth age is 38 years. If woman has first childbirth below 30 years, the chances of cancer, breast cancer, comes down by 60%. Okay, 1. No, it's not socially viable. You have to stabilize, you have to be financially empowered, you have so that's the problem. That is, it's innovative. So society is growing, it cannot do. Then they use a lot of OCPs, oral contraceptives, because they don't want to have child. So that also has an effect. That factor I don't think. Another thing is alcohol. Alcohol is actually, if you have a tendency for malignancy, it actually accentuates. It's like if I'm a person who has anger inside, something stimulates and I burst out, adhe marina. So alcohol and smoking direct effect illa cancer la, but it can enhance the potential to have a cancer. This mood factor kanna western country la, nowadays I think it's a very relative term where they do for mammogram from 40 years promptly. So namma mammogram ku inga varadanaga hospital patient puchu kudukranga namma nu solliduvaanga. Adha appadam solluvaanga. So mammogram ellam pandradhana obviously they get detected early and more women will get detected. If detected early, it can be cured. And I am telling you, in India, in 32 years what I practiced, I have seen 82 to 85% cure rate in India itself. Those who came stage 1, stage 2 disease. Why rest of the people did not get cured? Because they discontinued, they are scared. So, if all of us decide that I will be aware of it and I will go and get oxygen meter vechinu COVID 95, 99, 97 anane level 1 varanga adhe madrina. Stage 2 has statistically 95% survival. It's better than survival outcome by heart disease. All it needs is early detection. Next one. And losing inhibition. People don't come and tell. How to self-check? Your breast examination by yourself at home is sufficient enough. You don't have to go and do any test. You don't have to invest any money directly. How sensitive it is? Mammogram na edutalla. Mammogram 100 பேர் mammogram எடுத்து 100 பேர் self check பண்ணாங்க. It's 98% effective. So அந்த 2% effectiveness காக நான் எல்லாரையும் mammogram பண்ண சொல்லல. Yes, after 40 years you can do mammogram, but before that just self check. 5th day after your period, keep checking. 1 day in a month. That itself catches most of the cancer. Next one. So this is the steps. First, stand in front of mirror. Keep your hands up. That will show inequality in the breast size. That means the size which is shrunk or more big you can detect directly in the mirror. Then keep your hands in both hips so that the nipple side it's deviating or not, you see. Then palpation. Don't forget to palpate the nipple and lie down, palpate the underneath of it. So most of the cases can be detected. Any doctor first detects by this, suspects and then only sends for mammogram. Next one. What is mammogram? It's X-ray of breast. Just simple X-ray of breast. See, this is the normal breast and this is the lesion, which is very small stage 1. So, அது ஒரு பெரிய கம்பசுக்கிற வேலை இல்லை, பெரிய சிடி ஸ்கேன் அந்த மாதிரிலாம் இல்லை. ஜஸ்ட் எக்ஸ்ரே செஸ்ட் எடுக்கிறப்பல எக்ஸ்ரே ஆஃப் breast. Next one. Who needs mammogram? Mammogram ஒன்றா எப்போ ஸ்டார்ட் பண்ணணும், எத்தனை வருஷத்துக்கு ஒரு வாட்டி பண்ணணும்? All women above 40 needs mammogram once in 2 years. Yeah, once in 2 years, அது நடுவில் வந்தால் by statistics they have done once a year, once in 2 years, once in 5 years. And they found most of the cases can be detected if regularly do once in 2 years. Suspected carcinoma of breast needs mammogram. So, if you have palpate பண்ணி பார்க்கறதே lump மாதிரி இருந்ததுன்னா அது ரூல் அவுட் பண்ணுறதுக்கு கேன்சரா இல்லைங்கிறதுக்கு mammogram பண்ணணும். And those person who has a family history of CA breast should do mammogram once a year above 40. What is family history? First degree. அம்மாக்கு, சித்திக்கு, பாட்டிக்கு, அத்தைக்கு இவாளுக்கெல்லாம் இருந்ததுன்னா you should do once in a year. Otherwise, once in 2 years is more than enough. Next one. So this is United. Now the Lapsa United Nations India has estimated 1.16 million new cases every year. Okay, that says 1 in 10 Indians can develop some cancer. நம்ம எத்தனை 20 பேர் இருக்குமா, 2 பேர் கட்டாயமாக யாருன்னு தெரியாது, லாஸ் மெத்தட் தான். அதில் 1 in 15 15 கேன்சர் பேஷண்ட் இருக்காங்கன்னா 15 பேரில் ஒருத்தர் கட்டாயமாக உயிரிழக்க வாய்ப்பு உண்டு கேன்சர்னால. So this is like COVID. What happens in COVID? Initially people didn't listen. Jatosham mari romba pesப்படுtranga. And then they came late stage and they say, doctor, do something. அப்படி கிடையாது. இப்போ என்ன பண்றாங்க? வெறும் ஃபீவர்னாலே வராங்க. That's what I want all of you to understand. Cancer you should do like that. Suspected na rule it out. நான் ஒரு பேஷண்ட் வந்து ஃபீவர்னால வந்தால் டெஸ்ட் பண்ணுறது பிளேட்லெட் கவுண்ட் கம்மியாக இருந்துச்சு சொல்லி ஒரு டெங்கு டெஸ்ட் ரன் பண்ணோம்னா அது டெங்குவாக இருந்தது கரெக்ட் போகுதுன்னா அது டெங்குன்னு வந்தது. அப்புறம் கூப்பிட்டாரு அவங்களுக்கு வந்து இது இல்லை கோவிட் இல்லை டெங்குன்னா திட்டுறாருங்க. அதே மாதிரி கோவிட் சிம்டம்ஸ் எல்லாமே எல்லா இடத்துக்கும் நீங்கள் டெங்குன்னு எப்படி சொல்லலாங்க? I appreciate that person. So that is the level of awareness COVID has created. So same awareness you should have. Don't get scared and run away. I'm telling this magnitude to caution you not to scare you. Next one. The most common cancer in men is carcinoma of prostate. This one organ grows when you get old. Palamudi udududam skin and wrinkles varum. But prostate grows as you get old. It's very easy. If you detect PSA, the carcinoma prostate early, you are 100% cure. PSA detection, it started in 1986. People know that it's a simple blood test which can give the guideline whether you have CA prostate or not. 2 ml of blood, that's all, blood sugar check pandrapola. Once a year, anybody above 50 years should do PSA regularly. And that shows the suspicion of prostate, no further evaluation done. Other symptoms associated with prostate enlargement is difficulty in passing urine, frequency of urine. Urine vadila varavana adapus katnala urine free varadu irundu varum. So avlo frequency you know காதால வேலைக்கு போனால் நடுவில் ஒரு வாட்டி தான் யூரின் போவாங்க ராத்திரி வருவாங்க இப்போ 4 வாட்டி போவாங்கன்னா that's a cheat. Just contact your doctor to rule out CA prostate. Older age do relatively better than younger age. 2% of prostate cancer is detected between 50 to 55. They really don't do well. They are the one who needs very aggressive treatment. Rest of the people above 60, they generally never die of CA prostate. That much I can tell. They'll have heart attack, old age problem, their life expectancy will be maintained. Above 60 if somebody develops CA prostate. So early detection help in curing the cancer. Next slide. No? The other one is lung cancer, which is very, very common in India, particularly in northeast part of India. Total number of cases diagnosed is 15.4. Apna 100 cases pathona the 5% vandu CA lung. So top 3 cancers in men is lung, prostate, colorectal cancer. 28% carcinoma and lung is seen in smokers. How does smoker get affected by smoking? Next slide. See, smoking is the leading cause of preventable death in birth. I am not just talking about cancer. Most harmful evil in civilian life. No organ or body part is escaped. Everything gets affected. Any form it is bad. 400 toxic chemicals have been identified in tobacco. There we are. 400 toxic substances inhaled pandrathu adutha. So how risky is smoking? 10 cigarettes per day for every year, life is reduced by 1 month. If one smokes 10 cigarettes per day for 12 years, his life is shortened by 1 year. Any given time, if you stop the smoking, things can get reversed by 6 months. So this is another thing I want to create awareness, that smoking influences the well-being of people. So quit smoking if somebody is there. It has to be a big movement like how COVID has been promoted by government and social organization. So cancer awareness and smoking. These two, 50% of disease is gone if you promote these two things. It's a small group. I thought I should talk to you one-on-one like this and create an awareness. You are the one who will go and talk to other people. That people will be more receptive. Then I try to go and then they say that I am downscaling the risk. But when common காமன் பீப்புள் டிஸ்கஸ், மூவி டிஸ்கஸ் பண்ணுறாங்க, பாலிட்டிக்ஸை டிஸ்கஸ் பண்ணுறப்பெல்லாம் எங்கேயும் பார்க்க முடியாது. அதே மாதிரி கிரிக்கெட், மூணும் உதவாது நம்மளுக்கு, இது உதவும். ஸோ ஐ வுட் லைக் ஆல் ஆஃப் யூ டு பி மோர் active, proactive, and because since you are the group who is aware of your wellness of health, so please do that. And anybody has any question, you can ask me.
Ma'am, the lifestyle modification ஆல வந்து இந்த கேன்சர் வரதுக்கு ப்ராசஸ் அதிகமா இருக்கா இல்லைன்னா ட்ரெடிஷ்னலா வந்து வருது?
யார் வேணா கேன்சர் வரலாம். Lifestyle modification, it does two things. One, your food habit changes. The fat content in your food is gone down, and then your obesity changes. One of the reason in cancer is obesity. More obese. There is a thin person 45 years and obese person, that is BMI more than 35. The likely possibility of having cancer in obese person is more than the thin person. That's why we insist on lifestyle modification. It attributes a lot. So lifestyle modification comes along with diet, maintaining your BMI, and regular exercise. Regular exercise actually reduces many diseases. One, it improves your resistance because every time you exercise, adrenaline and epinephrine is secreted. That epinephrine creates a feeling good factor in your brain, and adrenaline, of course, it increases your immunity. It's a very complex situation where what does exercise directly do? Yes, it reduces the burning of fat and it reduces the fat content. You are more fit. Beyond that, there is something hormonal control happens which improves your immunity. So, and another thing, tolerance for treatment is better to do regular exercise. Like chemotherapy, naanga kudukrona exercise pannama lodduna ukkandrukara kuduthaga, he might look healthy, but his tolerance is very poor. And somebody who is physically active, who does like morning 1 hour exercise, cycling, their tolerance for chemotherapy is they just have a cakewalk. So if chemotherapy tolerance is better, total dosage of drug delivery is possible. So obviously efficacy is in. Tolerance illadhavanukku na drug dose cost 10%. So obviously efficacy goes down. The repercussion and benefit of exercise and good lifestyle is not alone in preventing the disease, it goes long way in tolerating the treatment and outcome. So that's the reason everybody insists now for exercise. What is exercise? Why we have to do exercise? Nama mudiyorgal pannala nama em pandrom? Nothing. Or 50 years back, I am sure you people would have seen your father kaathala 4-5 manikku enna clinic povanga. கிணத்துலேருந்து தண்ணி அரைச்சி குடிச்சுட்டு கழனிக்கு போயிட்டு அட்லீஸ்ட் 6 hours they will be working. கழனியில் ஓடி ஆடி வேலை செய்யணும். they will eat only minimum கஞ்சி கூழ் அந்த மாதிரி தான் சாப்பிடுவாங்க. Then by evening when they come, they have to cut the grass for their animals. They come home, தண்ணியை இறைச்சி அனிமல்ஸை குளிப்பாட்டி அப்புறம் இவங்க குளிச்சு விறகு வெட்டி அதுக்கப்புறம் சாப்பாட்டுக்கு உட்காந்தா இவ்வளோதான் உள்ள சாப்பிடும். கழியோ இந்த மாதிரி எப்போ வேணாலும் போய் ஸ்வீட்ஸ் வாங்குறது. எப்போ those sweets were made once a year. தீபாவளிக்கு தான் இந்த ஸ்வீட், சீசனுக்கு தான் இந்த ஸ்வீட். இப்போ அப்படியே இருக்க சாயங்காலம் சாப்பிடணும் போல இருக்குன்னா மூக்கு சீட வருது. ஸோ வாட் will happen to your body? You are not doing those exercise. ஒரு பொம்பளை ஒரு வீட்டில் எவ்வளோ வேலை செய்யணும்னா ஃபஸ்ட்டு இந்த எண்டுலேருந்து அந்த எண்டு வீட்டுக்கு நடக்கிறது. நம்ம வீடு டபுள்னு தான் இருக்குது. they walk from end to end. முழுகிறது, கிணத்துலேருந்து தண்ணி இறக்கிறது, துணியை யாராலும் கல்லில் துவச்சி பார்த்துருக்கீங்களா? 9 கஜம் புடவைய ஈர புடவையை எடுத்து துவச்சி போடுங்க, உங்கள் கை இந்த காலத்துக்கு பறந்து வந்துடும். அதை போட்டு துணி அத்தனை பேருக்கும் புழிஞ்சு போட்டு and then again whole house cleaning is done by getting the water out of well. Your back will be so strong when you are doing that. What happens to your metabolism zooms. So they used to spend on an average 4,000 to 6,000 calories. What is our calorie? Even somebody very active 2,500 calories மேல நம்ம செலவழிக்கிறது இல்ல, இடம் இல்ல அது பண்றது. When there are compulsion, social compulsion to restrict this, then you should restrict your food and quality also. ஏன் எல்லாரும் தினம் முறுக்கு சீடை சாப்பிடணும், சாயங்காலம் போனால் நொறுக்கு தீனி சாப்பிடலாம்? அந்த காலத்தில் எவன் நொறுக்கு தீனி சாப்பிட்டான்? அந்த தீபாவளி பண்ணுற அந்த 500 லட்டுக்கு அத்தனை அடிதடி நடக்கும் வீட்டில். We just buy sweets like that, refined sugar, anything white is spoiled. Whether it is milk, white rice, sugar, paneer, All this has very refined food which is not good for your health. Simple. So what I should avoid? Avoid white things. So half of thing is gone with that. Am I right, Minnie, madam?
Yes, sir.
So Mrs. Minnie is there. She is a dietitian. She actually will tell you how to manage a healthy diet. Okay? So anything else?
மேம் வயசானவங்களுக்கு தான் அதிகமாக வருது. இப்போ தெரியுற மாதிரி ஏன் மேடம் அது 70-80 வயசுக்கு மேலே இருக்கிற லேடிஸோ இல்லை ஜென்ஸோ எங்கள் தாத்தா மாதிரி வயசு எங்கள் பாட்டி மாதிரி வயசு
லைஃப் ஸ்டைல் 70 வயசு 60 வயசுலாம் அந்த காலத்தில் எவ்வளோ வேலை பண்ணுவாங்க?
அவங்களுக்கு கேன்சர் வருது மேடம்.
அவங்களுக்கு தான் வரும். கேன்சர் இஸ் ஓல்ட் ஏஜ் பிகாஸ் யுவர் cell function ceases, your immunity ceases. But why it is coming at 45 years of age?
My problem. Old age, you are not allowed them to live there. We bring them here and keep them.
Exactly.
Actually,
So their natural habitat we are changing. Their habit change, their food habits change. How many old people walk 10 kilometers nowadays? எங்க போறாங்க? எனக்கு வயசாயிடுது, எனக்கு முட்டி வலி, போகாம இருந்தா முட்டி வலி தான் வரும். அந்த காலத்துல என்னோட தாத்தா பாட்டி 98 இயர்ஸ் வாழ்ந்தார். டிக்கெட்டே வாங்க போறது இல்லையா அப்படின்னு நானே தேடி பண்ணுவேன் எங்க குழு தாத்தாவா. And they used to cook on their own, they used to eat on their own. None of the men will allow their women to wash their clothes. It is something below their dignity. கையால ஆகுதுதான் நான் அப்படின்பாங்க. எத்தனை பேர் நம்ம துணியை நீ கையால துவைக்கிறோம்? Men don't do that much of work also as they grow old.
என்னோட மதர் மேடம் 70 இயர்ஸ் லாஸ்ட் ஜூன்ல இறந்துட்டாங்க பிகாஸ் ஆஃப் கோவிட். ஹாஸ்பிட்டலுக்கு போகிற அன்னைக்கு கூட வந்து ஷெட்யூலில் ஆனாலும்
COVID patients will do on their own.
அன்னைக்கு கூட பண்ணாங்க.
COVID is different than cancer.
முன்னாடி வரைக்கும்
There are COVID patients who came, walked in and they succumbed.
she walked in.
Yeah, they succumb after that. That COVID is completely different. It doesn't disable you.
இல்லை நீங்கள் சொல்கிறீங்களே அவங்க வேலையை அவங்க செஞ்சுப்பாங்கன்னு she cooks on her own. அவங்களோட துணி அவங்க தான் வாஷ் பண்ணிப்பாங்க, அவங்க வீடு அவங்க தான்
ஒரு 25 years முன்னாடி மிடில் கிளாஸ் எவ்ரிடே ஈவினிங் வீட்டில் இருக்கிற அம்மா வந்து நடந்து போய் காய்கறி வாங்கி பக்கத்தில் இருக்கிற கோவிலில் போயிட்டு வருவாங்க. இப்போ வாரத்துக்கு ஒரு வாட்டி ஸ்கூட்டரில் போய் ஹஸ்பண்டையோ இல்லை இவங்களே போய் வாங்கி ஃப்ரிட்ஜில் டம்ப் பண்ணி சாப்பிட்றாங்க. தட் வாக் இஸ் கான். ஃபஸ்ட் திங் அதே போயிடுது. பால் காரனை வச்சு பால் போட சொன்னால் ரொம்ப எழுவு. எங்கள் பாட்டிக்கலாம் காத்தால 4:30 மணிக்கு இருந்தால் அதை தான் க்யூவில் நின்றுட்டு. ஸோ யூ வில் பி லாஃபிங் க்யூவில் நின்றுலாம் வாங்குறேன். யூ நோ வாட் இட் டஸ்? யுவர் சோஷியல் கான்டாக்ட் வித் பீப்புள். உங்கள் அந்த தெருவில் இருக்கிற எல்லாரோடையும் உங்கள் சோஷியல் தட் நாட் ஃபீல் குட் ஃபேக்டர். அதெல்லாம் யாருமே பேச மாட்டாங்க. எல்லாரும் டிவிக்கு நேரம் உட்காந்து 7 மணி ஆனால் 7 ஒப்பாரி வைக்கிறத தான் பார்க்குறாங்க. அந்த காலத்தில் வழக்கு வச்சுட்டு எல்லாரும் கோவில் போவாங்க. கோவில்ங்கிறது ஒரு இடம் தான், பொது இடம் மாதிரியே. their social contact increase, feel good factor is there. அவங்களோட வருத்தத்தை எக்ஸ்பிரஸ் பண்ணுறதுக்கு ஃப்ரெண்ட்ஸ் இருப்பாங்க. அண்ட் தென் அது ஒரு பிரதட்சணம் 3 பிரதட்சணம் என்னதுக்கு பண்ண சொல்கிறாங்க? தட் இஸ் அ பிரிஸ்க் வாக். அதுக்கப்புறம் தான் வந்து சாப்பிடுவாங்க. யார் பண்ணுறாங்க அந்த காலத்தில்? கோவில் அங்கங்கே கட்டி விட்டாங்க. டாய்லெட் இருக்கோ இல்லையோ வீதிக்கு 4 கோவில் இருக்கு. யாராலும் அந்த கோவில் சைடு வழியில் ஸ்கூட்டரில் பார்த்து இப்படி பண்ணிட்டு போகிறாங்க. அது என்னன்னு எனக்கு தெரியாது. பட் அப்படிதான் ஆண்டவனா அதையும் ஒத்துக்கலாம்னு வச்சுக்கோங்க. Why so many கோவில்? Even you are not going there. Nobody does. யாராலும் குனிஞ்சு நமஸ்காரம் பண்ணி எழுந்துக்கிறாங்களா? நின்று இப்படி பண்ணுறாங்க, இப்படி ஈட்டுறாங்க, போயிட்டே இருக்காங்க. பண்ணுங்க 4 நமஸ்காரம். ஏன் இதுக்கு நேரம் ஆகாது? Nobody does. Everybody has a because he is not, God is not going to come and end up and கேட்க போகிறது இல்லைல்ல நம்மள. So we cut short so many things. நான் பண்ண முடியாத அசிங்கமாக இருக்கு. Accept it. ஒரு ஊரில் ஒரு கோவில் இருந்தால் 10 பேர் தான் போவார். இங்கே வச்சன்னு கோவிலுக்கே வந்து 1000 பேர் அங்கே வந்ததுன்னா டர்ட்டியாக இருக்குது. யூ ஆர் நாட் கோயிங் டு நமஸ்காரம் பண்ண. பட் those are all repercussions put together. So you can't blame I am alone and I am doing this so I have to be healthy. Being healthy starts from childhood to end, not at a spur of moment. It's a long process to keep yourself healthy for any disease. ஈவன் டயபெட்டிஸ் இன்னைக்கு வந்ததுன்னு நான் இன்னைக்கு வாக்கிங் பண்ணுறேன் வழியை காண்டி நீ ஃபஸ்ட்லேருந்து வாக்கிங் பண்ணியிருந்தா தான் உனக்கு வந்து நீட் ஆஃப் இன்சுலின் வில் பி லெஸ், யுவர் நீட் ஃபார் அண்ட் டயட்டையும் அட்ஜஸ்ட் பண்ணால் தான் யூ டோன்ட் ஈவன் நீட் மெடிக்கேஷன் ஃபார் டயபெட்டிஸ். வந்தப்போ நீங்கள் பண்ணி என்ன பிரயோஜனம் சொல்லுங்கள்? கோவிட் வந்தப்போ நான் ஸ்மோக்கிங் குவிட் பண்ணேன் ரொம்ப நல்லது. ஏன்னா உன்னால் முடியாது, அதனால குவிட் பண்ணேன். அவ்வளோதானே வழியே அது பெரிய மெப்பா சொல்லிப்பாங்க. நான் கோவிட் வந்தது ஸ்மோக் பண்ணுறது இதை பண்ணி தான் பாரு. மூச்சு வாங்க பாத்ரூம் கூட போயிட்டு வர முடியாது. Okay, these kind of shortcuts we people do. Okay, we'll have another session sometime, no worries. Okay, thank you.
Now for that, to give an awareness about the diet, what is right. Yeah. So, what to eat, how much to eat, and when to eat. These are the three basic questions. When diet is wrong, medicine of no use. And when diet is wrong, when diet is right, medicine of no need. That is the ancient Ayurvedic proverb. The first form of happiness is sound health. One should partake nutrition, balanced food to keep the body healthy. So it is essential to maintain the health of mind and body simultaneously. So, happiness. When your health is good, you feel, happiness from inside. 61.8% of deaths in India are caused by diet-related non-communicable diseases like diabetes, hypertension, and cardiovascular disease. So, we can prevent this disease by giving awareness. Before the diabetes it occurs, whether you have any genetically, predisposition. So we have to be very careful with our lifestyle, diet and exercise. And then you get the even in pre-diabetes situation, we can correct it by lifestyle modification. But when it is more than the HbA1c is more than 7, you have to consult the doctor and get medication. But then still you can control your blood sugar level. That is what, when you get diabetes means the type of food you eat, that counts. And amount which counts. And the duration, that also will count. Unsafe food cost in India since just used $15 billion annually, very high economic burden caused by foodborne disease. When you the foodborne disease, because of the unhygienic condition or contamination of food, all this will come under the foodborne diseases. Children, 47 million children are standard and 25 million are wasted. Because the micronutrient deficiency will cause the standard growth in children. So we have to, the baby when it is born from first day, the diet matters a lot. There's a proverb saying, you are what you eat. Okay? So the creating awareness, it is very important, especially for the ladies because they are the ones brings up the children. So, and 196 million chronic hungry, 500 million are micronutrient deficient, 180 million are overweight or obese, and 100 million are foodborne cases. So even overweight, obese children, they are malnourished. Very rich people, they too have, because they have all the junk food, so their nutrition is not proper. Micronutrient deficiency is a form of undernutrition that occurs when intake or absorption of vitamins and minerals is too low to sustain good health and development in children and normal physical and mental function in adults. So micronutrients are very important. It means very small amount, zinc, magnesium, chromium. So in biochemistry, anyway, those who learn biochemistry, they can understand. even for the catalytic reaction, this micronutrient is very much essential, you know. So, very balanced diet, you know, which has minerals, micronutrient, carbohydrate, protein, fat, everything included in that. So there is a coexistence of multiple micronutrient deficiency that accounts for iron deficiency anemia, calcium deficiency and iodine deficiency. At anemia, you know, when the hemoglobin is less, even the children, even cognitive behavior is, hampered. Even for ladies, when the HB is low, they are not able to function better. So we need a healthy population in India. Yeah, eat right. This is the very balanced diet. That is, roti or rice should be there, then one dal and one puri. And for fiber we have green leafy vegetables and salad also for the vitamins and this. This is the very balanced diet plate. Eat healthy, eat safe and eat sustainable. This is our message which I have to tell you. Yeah, personal and surrounding hygiene. In eat safe, first comes the hygienic food habits, personal surrounding, awareness and knowledge of adulterants, reducing toxins and contaminants. And clean personal and surrounding hygiene, I think in COVID we have learned more of hand washing and clean hygienic food habits also. Then awareness and knowledge of adulterants. Adulterants, they adulterate the food in India. Even we have strong, PFA laws, but people are making, money by adulterating the food. That is even in turmeric, chili powder, even in ghee. I have seen they are coloring the green, they put in the dye, the cloth dyes, they will dip in the dye and for the green and it will turn into red. So that is very harmful for our body with this chemical. So always how you have to dip in the vegetable for some time, and if there is color means you discard the material itself. And make a complaint also so that they should not do it again. So toxins also same thing, and contaminants also. They use dirty water for the vegetable growing. So you have to clean the vegetable everything. COVID pandemic increased the awareness among the Indian consumers on the following issues, that is immunity, and new expert and demand such as dietitians, hygiene in the daily lives, social distancing, new media and reading habits are started to evolve the change in digital media dominating the consumer habit. Okay? So immunity is the basic body fighter against the coronavirus, and only the individuals with weaker immunity have the victims of the coronavirus attack. So we have seen people now, those are very healthy. What to say? They are not affected that much. So we have to build immunity by diet and lifestyle modifications. So new expert demands just hygiene in the daily life, social distancing, new media. But the communicable disease after wearing this mask, I have seen so much of it has reduced much even in schools now. Small children in one child gets cold means the whole class used to get. But now and even the small children, they are aware about hand washing. It has reduced to such an extent. That's a good thing pandemic had taught us, Okay. Yeah. Awareness and knowledge of ingredients and adulterants. Always read the labels. How much fat, trans fats. And sometimes, even adulterants, they don't put the name, code they use. For the, even coloring also, for their, some codes they are using. So that the common man, they are not able to understand. Okay? So in this, trans fat is a very, dangerous fat which will, stick on your heart artery and it will cause the heart attack. Okay? Yeah, there are two forms of fat, that is one is cis fat and trans fat. So trans fat, that is why the dietitian will always we advise the patients not to have bakery products. Bakery products, to get the texture, they use trans fat, hydrogenated fat. So even puffs you have seen the texture. Normal oil you will not get it in baking. Okay. Scan the ingredients list. Even food ingredients used are mentioned according to their quantity used. Scanning the first line of the ingredients gives fair idea about the product content. If sugar is mentioned in the top 3 ingredients, then it has high levels of sugar. Yeah, as ma'am said, Renu said, or you have to be careful about the white, sugar, salt, and maida, everything. The sugar consumption also used as much as minimum. Even when you inculcate the food habits in the children, they don't need sugar. When we put sugar in the milk and we are the culprits. We are giving them salt, sugar, which is not needed. Every day we need maximum 5 grams. That is 1 teaspoon of salt only we need. The sugar, carbohydrate, we get it like that. We don't have to put. But the habit which we form from the childhood, which will be lifelong. So that is my advice. Whenever it's better trying to inculcate the good habits is when they are raised. Calculate the serving size. Many food packs are meant to be consumed over a while. Therefore, come with more than 1 serving quantity. It is important to calculate nutritional content according to your own serving size. Serving size also. So when you are enough, then don't compel to eat more. 1 serving, that's enough. The more you eat, the stomach, the size will become big, and then there is a chance for the concept of obesity. Calories. Looking at the number of calories will help you plan your meals and avoid unhealthy food as much as possible. Keeping a track of calorie intake and its source help meet the daily calorie requirement. Unprocessed and natural food have more of good calories. That is unprocessed and natural food. That is the traditional way of cooking. Rice, sambar, rasam, paripa, putta, all that. That is a very balanced diet. Yeah. So when you cut down the side dishes, this one, craving is more because you are not getting the micronutrient in that. Percentage daily value. Daily value on food labels are mentioned as a percentage of total nutrition requirement in a day, 1 serving. Okay, this I would request you to go and consult a dietitian and get a diet chart and go according to your calorie need. They will give you a diet chart and you can follow the diet chart. That will be better. Ingredients to closely at food labels, there is a chance of containing several harmful ingredients and additives. These include hydrogenated fats, I have already said hydrogenated fat, sodium and high amount of sugar, and artificial sweeteners, colors, flavor should be avoided at all costs. Highly processed foods contain a lot of these ingredients. Go for more natural, fresh and whole ingredients. Whatever comes in the packets, nowadays we use scissor more than the chaku, snail. Right. So the processed food, whatever it is, use minimum. That is my, request for you. So try to eat healthy. Next question. Yeah. Diet diversity and balanced diet. Balanced diet I have already said. Diet diversities have more varieties of food. In Tamil Nadu we have different types of Curi and panangalan. Each has a nutritional value. In ancient people they are aware, they are much more, they have more awareness than us because they had a joint family, and we nowadays we are in nuclear family, so no one is there to advise you when the diet is going wrong, and plus the work pressure, even ladies are working, they don't have time to cook all this thing. Reducing consumption of salt, sugar and saturated fat. Addressing micronutrient deficiency. Micronutrients are, this zinc, calcium, all vitamins. All vitamins we need. So that's why every day you have to have a fruit. And diabetic five fruits are avoided. Mango, grapes, all banana, chiku, all this you have to avoid as far as possible. But then if you don't have diabetes or a kidney problem, you can have any fruit, and you should have a minimum 80 grams of fruits daily. Okay? And salad also is a must. Fiber. And saag also, every alternate day you can make saag or bitter gourd, which has more fiber. Okay? So avoid maida and have, you can practice buying the whole wheat and get it grinded in the mill. That would be, you will have more fiber in that. Okay? Yeah, eat healthy, balance diet, eat less and eat timely. Yeah. That as a beginning I said, time is very important. Time, amount and what you are eating, how much you are eating, and the time is also very important. Diet diversification, eat variety of food, eliminate toxic industrial trans fats, reduce consumption of salt and sugar and saturated fat, eating fortified staples to address micronutrient deficiencies. Yeah, in maize and all they have introduced vitamin A, WHO, so that the vitamin A deficiency will be less in the common public. Next. Diet diversity is defined as the number of different foods and food groups consumed over a given reference period. Different foods and food groups are good source of various macro and micronutrients. So a diverse diet best ensures nutrient adequacy. Okay. So these are the macronutrients, carbohydrates and protein. This eat moderately like fruits. I have told you 80 to 100 grams enough. This is eat sparingly. And fat or fried stuffs. This this has to eat sparingly, eat moderately. This oil we need 4 teaspoons a day. And chicken, fish, whatever it is. And this is eat liberally. Fruits you can eat enough. But minimum it should be 80 grams every day. Eat adequately, carbohydrates. enough you can eat. So this is the plate method. Okay. This is the yeah. 3/4 of this baby. This is carbohydrate. This one is protein, and this is fruits and vegetables, salads and fruits. And this is again oil and other stuff. Oil also we need. Yeah, because 20 ml of oil minimum we need. Otherwise, your vitamin, fat soluble vitamin will not get absorbed in the body. That's why they give. Yeah. This is the research I have done. Salt used while cooking is 8 grams per day. Processed food is 1.1, natural food 0.9. So total consumption is 10 grams per day. But we need only, according to WHO guidelines, we need only 5 grams. 5 grams is 1 teaspoon. Okay. So hypertensive patient, cardiovascular patient, we tell them to avoid salt. Because it has an affinity towards the water, and water retention will be there. Bipolar edema, all these things will be there. So, yeah, this I have already said many different ways how many grams are taken. Tripura they are 13.14 grams per day because in the Sukhamachli water that salt, dry fish and papad and chips, they use a lot of salt which is not needed. Okay? Yeah. Dietary approach to prevent hypertension, DASH diet. So to prevent the hypertension, you have to use minimum amount of salt. Combating micronutrient deficiencies, traditional fortification, dietary supplements needed with added nutrients. Selective breeding. Selective breeding means genetically, some breeds have more vitamins. Like some maize genetically they have more vitamin A. Yeah. What can biofortification do? Develop wheat, rice, maize, cassava and other staples packed with additional vitamins or minerals. Nutritional benefits will be coming from crops harvest after harvest with no additional cost. Reach those who are not reached by their other nutritional interventions. Zinc rice. Nutritional benefits provides up to 40% of daily zinc needs. Farmers and high yield, disease and pest resistant. These are the genetic, that variety it has more zinc. Same way, vitamin A sweet potato, it has more vitamin A. Even cassava, zinc wheat are there, iron pearl millets are there, zinc maize, vitamin A maize, iron beans. All this as we need but in smaller amount. Yeah. Eat locally grown foods and seasonal foods. Yeah, this is what I want to assess certain points, because we buy apple or some fruits from the export fruits from other countries or states. We don't need that actually. In this area around our place, whatever fruits or vegetables are grown, that is good for us, because our body, our way of life, everything according to that. Even winter season in North India, we get certain fruits. That fruit they need for that season. Okay, so seasonal, locally grown fruits and seasonal fruits, in this month they don't add any preservative. So you are getting it fresh. Eat chemical-free fruits. Yeah. Organic food will be better. Pesticides they put So my humble request is everybody should have a kitchen garden. If you have a even small places, if people are growing on the terrace itself, they are whatever they can have what say chilies or what is muriga. All this thing you can plant and make a habit, so that your next generation also will be, they will also have an interest too. So that is one point I can and request you all to do, start doing it, and then eat locally grown. Yeah. So what is seasonal food? Seasonal food is produced, that is purchased and consumed around the time that it is harvested. When it is harvested, we are purchasing it. So there is no the putting of preservatives and such things. Why it is important to eat food that in season? Seasonal food is fresher, tastier, more nutritious than food consumed out of season. Seasonal fruit and vegetables produced on local farms are often fresher. They do not require long distances for transport, unlike out of season produce, which is harvested early in order to be shipped and distributed to your local retail store. Crops picked at their peak of ripeness are also better tasting and full of flavor. Correct. And studies have shown that fruits and vegetables contain more nutrients when allowed to ripen naturally on the parent plant. I understood that point. In mango, they are carbide, they are using to ripen the. You all know that, you all have heard about that. Carbide they put to ripen the. So that is a poison. So whatever food, fully grown and it is even palapam also, when it is ripened in the tree, that has more flavor and nutrition than we cut it before the time and make it to ripen. Okay? Look for certifications, organic labels should taste natural, smaller in size. Yeah, don't go for the bigger size. Hybrid, bigger size means you are putting something hormone or some injection they are doing to make it big. Okay, highly perishable, lower storage life, locally produced. So you have to encourage the local vendors. They are also giving instead of going to the big malls and they preserve, you can buy locally grown vegetables with the local vendor. I think that would be better. Yeah, any questions?
Ma'am, on request ma'am, இதை வந்து எங்களோட மெயில் ஐடி எல்லாம் கொடுத்துருக்கோம். எங்களுக்கு இதை ஃபார்வர்ட் பண்ணினா பெட்டராக இருக்கும். யூஷுவல் வீக்லி கூட நாங்கள் பார்த்து என்னென்னலாம் அவாய்ட் பண்ணலாம்ன்றது தெரிஞ்சுக்கலாம். Already we have the mail ID and they have formed a group also, WhatsApp group மாதிரி. அதில் போட்டால் கூட ஓகே.
Okay. Any questions?
One question ma'am. இந்த ரீஹீட்டிங்னு வரும்பொழுது வந்து ஸ்டவ்வில் வச்சு ரீஹீட் பண்ணுறது பெட்டரா இல்லை ஓவனில் வச்சு பண்ணுறது பெட்டரா?
Yeah, that's still it's a controversy because micro oven, they say it is the radiation, but how far it is true.
ஏன்னா பேக்கிங் எல்லாமே என்னன்னா ஃபாரின்ல ஆகட்டும் இந்தியாவில் ஆகட்டும் இல்லை லேடிஸ் ஆகட்டும் எல்லாமே ஓவன் தான் அவங்க வந்து குக் பண்ணுறாங்க. ஸோ வீடுன்னு வரும்பொழுது எவ்ரி ஒன் ஹேஸ் அ மைக்ரோவேவ் ஓவன். ஸோ ரீஹீட்டிங்னு வரும்போது அதில் ரொம்ப ஃபாஸ்ட்டாக ஆகிடுது. நம்ம ஃபஸ்ட்டு இதில் பண்ணுறது பெட்டரா இல்லை அதில் பண்ணால் பரவாயில்லையான்னு கேட்குறேன்.
Gas, heating in the flame will be better.
That will be better.
Yeah. Because still we don't know there is radiation message, so that will be better. Yeah, that's correct. After preparing the food, there is a time limit. Within that time, if we eat, that will be better than keeping in the fridge and reheating it. So the nutrition will be
அவாய்ட் பண்ணணும்னு நினைக்கிறோம். பட் தென் வந்து அதை வேஸ்ட்டும் பண்ண முடியாதுன்னு வச்சுக்கோங்களேன். ஒரு சில ப்ராடக்ட்ஸை வந்து நம்ம வேஸ்ட் பண்ண முடியாது, ரீயூஸ் பண்ணலாம்னு வரும்பொழுது அப்போ ரீபீட்டிங் நம்ம பண்ணுறோம். காலையில் இருக்கிற ஸ்கம்பர் பேலன்ஸ் இருக்குன்னு வச்சுக்கோங்களேன், அது வந்து நைட் யூஸ் பண்ணிக்கலாம். ஸோ அப்போ ஈவினிங்குள்ள நம்ம ஒரு தடவை ஹீட் பண்ணுறோம். ஸோ லைக் சம் வெஜிடபிள்ஸ் வந்து ரிக்வயர்ஸ் ஹீட்டி, மத்தியானம் சாப்பிட வேண்டியவங்க சாப்பிடாம போயிட்டாங்கன்னா அது அப்படியே நின்று போயிடுது. ஸோ தட் we are going to use it in the during night and வரும்பொழுது குவான்டிட்டி மெஷர் பண்ணி தான் பண்ணாலும் சம்டைம்ஸ் வந்து
it happens
in all modes. லஞ்சுக்கு வருதுன்னு சொல்லிட்டு போகிறாங்க, லஞ்சுக்கு வரல. ஸோ அந்த போர்ஷன் வந்து அப்படியே நின்று போயிடுது.
I would suggest you to go for the traditional way of having padaya sadam, water rice. We have more rice, put it in the water, and next day morning, have with the green chili, small onion, and this one curd, and have one piece of, if you are non-vegetarian, have a sukha machli, dry fish. You can have something like that. That has the nutritional quality has been more in that.
டெய்லி எடுத்துக்கலாமா இல்லை அதுக்கு ஏதாவது ஒரு வாரத்துக்கு தரலாம்?
That is daily எடுத்தாலும் பரவாயில்லை, you will be more healthier.
இல்லை அட்லீஸ்ட் மோருக்காக அதை யூஸ் பண்ணலாமா?
Curd, all this thing, and incorporate more ragi. The thinai, samai, all foxtail, millets, all millets you try to consume more. Traditional. And one more point I have to tell you is when you make idli or whatever it is, you go for the portion size, portioning, the ratio, like 3:1, whatever it is. When you make khichdi, that dal and rice, that ratio has to be correct. Okay?
So 1:2:3 is the ratio.
Yeah.
3 வந்து அந்த அரிசி,
Rice.
இட்லி அரிசி, 2 வந்து பச்சரிசி, 1 வந்து உளுந்துன்னு எடுத்துக்கலாம். இந்த காம்பினேஷன்ல ஏதாவது வேற ஏதாவது ஆட் பண்ணி
that is a traditional way, right? Traditional, yeah. Then fermenting. Fermenting, it has a wonderful effect on your body because your vitamin B is being increased and your microbiota, that will be more healthier. That's why in North India they say you South Indian people are more healthier. Gut, that is more healthy. Every problem will start with the stomach. That is the, even your moods are changed by if you are not well. In the stomach, your attitude, mood, everything will change. So that is what, being healthy. That is the state of your well-being, your mental, physical state. Even if you don't have more money, and the health, if you are good in your health, you are happy. Am I right? You have so much of money, if you don't have good health, no use. And the happiness, it should come from inside your body. Even yoga, it will help you, physically. That man said, adrenaline and epinephrine, all the hormones, that will produce and well-being, feeling of wellness. That's why exercise is also important. Minimum, even if you cannot do yoga, minimum 45 minutes walking, brisk walking, that is, blood circulation, and the happy hormones are used, serotonin. All these things, it will make you happy. That's why you will be addicted, Like you are having a habit of walking. One day or 2 days you are not doing. Feel like going, Feel like going. That is the that happy hormone works in your body. So basically, I want to tell you hygiene. Basic hygiene is very important. Hand hygiene, food, even food, whatever, wash it properly, and cook. And salad especially, wash, when you cook. And this good habit has to be taught to your next generation. Because they are your future. Even they are adamant on this one. I want this one, I want all junk food, pizza, all this thing.
restrict them to the once in a month. Because that cause have a very bad effect on the body. For cancer, everything, that is the basic reason. So even for even night, if you have a milk, put 1 teaspoon of turmeric powder, no turmeric powder. With turmeric powder and have that, one way it prevents the cancer. So hygiene is important, what you eat is important, how you eat is important, how much you are eating is important, all the basic things. Okay? Any questions? Sir, any questions?
In place of sugar, what is the other replacement? Shall we use stevia?
Stevia, anything artificial is dangerous. That's what I said. Inculcate the good habits in the children, because you are from your childhood, the mommy has given you sweet, sugar. So the habits you can make. 21 days, if you eat without sugar, it will become a habit. You can come out. Because sweet, even cancer, I was telling that cancer, one of the major causes is sugar consumption. If you, totally if you avoid the sugar, means the cancer cell growth will be stunted.
So even avoid sugar food.
Yes. And once in a while sweets you can have for this thing. And avoid trans fats, hydrogenated fat, dal or the things,
And give examples of trans fat.
Trans fat, yeah, the hydrogenated fat is trans fat. Okay, they used to, maybe 20 years back they had advertisement, now you are not seeing that in the TV, no, that is because they have the awareness now, it is not good for the body.
Oil is converted into solid. Unlike ghee, vegetable oils are converted like a ghee.
They
It's
put
all
converted with the hydrogen ion in the fat. So that will go and directly it will stick on your artery, heart gap. And red meat after an age, you have to avoid red meat like mutton. It is highly saturated, so much of saturated fat. But children, you can have mutton after. But if you are prone to have cardiac disease, then something genetic background is there. Okay? The genetic familial triglyceride is there. Familiar heart cardiac problem is there, the familiar diabetes, hypertension, even cancers are, even breast cancer, cervical cancer, everything is genetic. It comes with the genes. So those who are prone to it, you have to be careful. That is the wise way of doing. So we dietitians are here to create awareness in the public. So because we in India we need healthy people, then only we will grow.
And coming to this point, salt you told,
Yes, sir.
Because being in South India, most of our food from all the 3 weeks basically, we consume salt. So how to reduce that? Because mostly more than 10 grams itself we are
5 grams is the maximum. That's what it's keep it, reduce it. Always you tell your brain, I should reduce.
So and having non-vegetarian daily is also good.
Non-vegetarian fish is good, sir. Fish, it has omega-3 fatty acid. Even water fish, fatty fishes, it has salmon, all this they have omega-3 fatty acid, which is good to remove the blocks from your heart vessels. So, fish also try to remove. Chicken also you can have once or twice in a week you can have, but mutton is only once in a month. So making also a different, the cooking method also comes.
Fish, all
of getting urine as well. So what I want to say is everything, almost all disease we can control by diet. The main thing is awareness. When you go in an airport, you see so much of junk foods, pizza, all this thing, puffs, sort of thing. But it is you to select what is right and wrong. Then I go for idli, sambar, and that.
Always the paper is on.
And with the correct idli with sambar or idiyappam with the red curry on the chana curry. So that the protein and the carbohydrate ratio will be, we need a protein 1 gram per kg body weight. If you are 80 kg means every day we need 80 grams of protein. Okay? Then only even the muscle, when you go to the gym, you should have a protein. Otherwise, there's no muscle has to be. And this is the second part of your